This is a bead of courage given to a child with cancer for every procedure they go through. This one is for a clinic visit. This one for a spinal injection, intensive care, chemotherapy, bone marrow transplant. These are Emma's beads, all 1,900 of them. With your help, the Child Cancer Foundation can continue to be there for brave kids like Emma. Please give generously. You can even text BEAD to 206 to donate right now.
Maybe we'd like to hear from our CSR partners as to what is your involvement to this project.
Dr. Dolendo explained earlier, we are here just to support her in her early childhood campaign. No? So it's basically more like we are her back room. No? Parang ibig sabihin, siya yung front namin, kami nasa likod lang po kami. That's our main goal for partnering with the Davao Child Cancer Fund. So basically, yun yung aming trabaho with Dr. May. Thank you.
Hi, good morning, everyone. Just like what Maribel said, no, we're here to support the things that the Davao Child Cancer Fund is doing. It was a coincidence that almost all their branches that they're set up, we're also there because of our business, the 4 dealerships. So that was a best fit for us to serve them, and we're here to support because we believe that it is a very noble cause, and whatever Dr. May says, we'll just support them na lang all the way.
Thank you, sir.
Good morning, everyone. I just want to say it's a pleasure to be in the Philippines. It's my first visit, and I'm really enjoying being here. May is the most wonderful host. Thank you. Is that?
Yeah, I think you should use this.
World Child Cancer is a UK-based charity, and we help children with cancer in low and middle-income countries by creating twinning partnerships between hospitals in low middle-income countries and hospitals in high-income countries. We've been working with Doc May here in Mindanao for about 4 years, and we have been funding certain elements of the satellite network centre, so some of the staff salaries and some of the training costs, and we're delighted to be involved. It's a fantastic project, and we are thrilled that the team is making so much progress in terms of increasing access to treatment and improving survival rates. So well done, May, to you and your team. One of the reasons I'm here is that I'm here to actually look at potentially World Child Cancer funding this project for a further 3 to 5 years. So what I'm saying at the moment is very positive, and we very much hope that we will be able to do that in the future. Thank you.
So good morning, everyone. Actually, I'd like to make a correction. Actually, it was not May, Dr. Dolendo, who courted me. Actually, I have been aware of what she has been doing in Davao, and several years before I told me, May, could I borrow you in Cagayan de Oro so you could also help us out with our oncology patients, because I am a hematologist. I am not an oncologist. So whenever I have onco patients, I always call May, for help. And actually in our area, in NMMC, for the past, just for your information, for the past 6 years, we have seen only around 16 cases of retinoblastoma. And most of these cases are already on the advanced stage, so we could probably do nothing with these patients. And I think most of them probably really succumb to the disease, no? So hopefully with this partnership with World Child Cancer and DCCFI coming over to our area, I'm sure we will be able to increase the survival rate, of these patients, because retinoblastoma, as was mentioned by Dr. Dolan, is a very curable disorder if diagnosed early. Okay. So I am very hopeful that this program will be successful also in Northern Mindanao. Thank you.
All right, so let's start the ball rolling. So who will take the first question? Nauna si Butch, then he will be followed by Mr. Montalban.
Good morning. The perception is that cancer, you can have cancer because it is genetically acquired, but not anymore. Anybody can have cancer any time of the day. So my question is, why is it now easy for one to have cancer? And it seems that the number is doubling and tripling, and until now, there is no cure for cancer because they say cancer is incurable, but it can be managed. So, what is the situation in Mindanao? So, is it attributed to the lifestyle, the food we eat, especially the children now are eating anything that is edible, junk foods, whatever, the soft drinks and the likes. So, can you explain the scenario in Mindanao, how we can help and take care of our children not to have cancer or a serious disease?
Well, I'm probably the most appropriate person to answer that. First of all, let me just clarify. Yung cancer sa mga bata, iba po sa cancer sa mga matatanda. No? The most common cancer that we see in children is leukemia. Half of the cancers that we see, let's say kung merong 100 na bata na may cancer, kalahati po leukemia. Yung mga cancer sa adults, now, mas na-associate natin ang cancer with adults because it's actually more common in adults. No? If there are 100 patients, both children and adults, 10% lang po ang bata doon. 90% po ang matatanda because as we grow older, our risk for cancer actually increases. And kung na-notice nyo po, the kinds of cancer that we see in adults are more secondary to lifestyle. Diba? Pag malakas ka magsigarilyo, you get lung cancer, malakas ka uminom, you get stomach or pancreas or gastric cancer, no? But in children it's different. Mas complicated po sa mga bata. Hindi siya lifestyle, hindi naman sila nagsisigarilyo, hindi naman sila umiinom, no? So the causes of cancer in children is multifactorial. Wala pong single cause. Pwedeng genetic predisposition, let's say in families na maraming cancer sa kanila, so ang tendency for the children is also they are at higher risk for cancer. Number two, pwedeng genetic susceptibility. Yung mga patients na Down syndrome, they have higher chances of getting leukemia. No? And the other things na pwede is environmental exposure. Yun yung second hit. So kung halimbawa, yung family ninyo, marami na talagang may cancer, yung bata naman, meron siyang higher chances of getting cancer if na second hit, kagaya ng environmental exposures, no? Kaning pesticides, smoke, environmental exhaust vehicles, no, viruses, no, infection, no, this. So hindi siya single cause. Kaya mahirap i-prevent sa mga bata except for a few cancers. Kasi sa adults, pwede nating sabihin, huwag kayong magsigarilyo, huwag kayong uminom. You live healthily. So para ma-prevent mo ang cancer. But sa children is very difficult. Very little lang siguro yung ma-prevent natin. Hepatoblastoma or hepatocellular carcinoma pwedeng ma-prevent with hepatitis B immunization. Your HPV vaccination sa teenagers pwede rin maka-prevent ng cervical cancer. But otherwise, there's not much that can prevent children from getting cancer. Hindi naman natin sila pwedeng i-avoid sa environment natin because, it's everywhere. Now, the second thing is yung sinasabi natin, bakit tumataas yung incidence ng cancer? Hindi po tumataas. Well, siguro, medyo, pero hindi po tumataas yung incidence ng cancer. Tumataas po yung detection rate natin. Nung unang panahon kasi, wala silang mapupuntahan. Hindi natin sila nakakount. So, namamatay lang sila where they are. So we didn't know that they had cancer and we were not able to account them. Pareho sa HIV. Sasabihin nila, ang dami daw sa Mindanao. It's only because we are screening here and we are listing all these people. Mas marami ho sa ibang lugar, hindi lang ho nila alam. So it's the same thing with child cancer. Dahil meron na pong center, meron na pong specialista, meron na po tayong capacity not only to diagnose but also to treat. So nakukuha na ho natin sila.
Say that once you are diagnosed that as a cancer patient, you are assumed to die. So how can we allay the fear of dying because you have cancer? Because as you said, for children, it's curable. But for adults, it might be curable, but there are so many complications that will happen along the way. So, because it is a dreaded disease.
I understand your question. That is partly true. Ang cancer kasi, pag wala kang gagawin, kaya nga I like my job. Kasi pag mag-usap kami ng families, pag sinabi ko sa kanilang pag wala tayong gagawin, talagang mamamatay yung pasyente ninyo. Kasi cancer siya di ba? Unlike asthma or, other types of diseases na pwedeng gumaling, pwedeng hindi. No? But for children, yung pinakita ho, that's why we wanted you to see the AVPs. Because we are able to show that we have cured children with cancer. So, curable ho talaga siya. In other countries, the US, in London, in leukemia po, 90% na sila. Tayo dito, across the country, siguro nasa 20% lang tayo. Kasi not all can access treatment. Hindi ho lahat may doktor na hematologist or oncologist na kagaya ko. So, our resources are very different from developed countries. And that is the reason why nakikipartner ho tayo. Ang lakas ho ng loob namin makipartner sa Amerika o kaya sa London, maski ganito tayo. Kasi gusto ko matuto paano nila ginagawa yung ginagawa nila. So we can also make it benefit our children here. So when we started in 2004, our survival was almost zero. It was less than 10%. It was really very sad when I was doing my training. Halos lahat ng pasyente na dinadaanan namin namatay. And I was very surprised when I went to Singapore that they have survivors. No, they have children who survived cancer treatment and became adults and had families of their own. So childhood cancer is curable. So yun kaya kami nag-early detection kasi una, marami tayong pasyente. Very limited ang resources natin. If we see them early, wala pang komplikasyon, we can actually save them. Konti lang yung gastos natin. And we could actually serve with what little that we have, we can actually serve more children, save more children.
Can you give us specific numbers? Like, you're based in Davao, maybe you have the numbers for Mindanao, or how many cases are we talking about?
Unfortunately, wala tayong cancer registry. No? The country does not have a cancer registry. Kaya kami nakaka-present ng data sa inyo because at SPMC, we have a cancer registry. And from 2004 hanggang ngayon, we were able to put into the registry 1,000 cases of child cancer. No? From 2004 hanggang ngayon. For 2012, nakakita kami ng 200 na mga bata, both may cancer at may mga sakit sa dugo. Yung cancer doon, 135, no, out of the 200 that we saw last year. So yun po yung exact figures with regards to the kinds of patients that we see. So kung estimated po sa Mindanao na 1,000 every year supposedly, so ang dami ho talagang hindi nakakarating sa amin. This is the reason why we are going out to get them.
My follow-up question is on prevention, because they said prevention is the best cure. How can we increase prevention? Even you said earlier it's difficult because of circumstances and all that. How do you prevent children from being exposed to
to the environment. But surely there must be something we can do on prevention. We just can't allow them to be victims of Mona Lisa, to lie there and to die there.
As I have mentioned before, there are two cancers na pwede natin ma-prevent. Hepatocellular carcinoma by giving hepatitis B vaccine, which we are already doing, no? Kasi when babies are born, immediately binibigyan sila ng Hep B. The second is cervical cancer, and this is HPV vaccination sa teenagers, no? So actually, yun lang yung medyo may klaro na talagang prevention for children. Now, the reason why we are doing early detection is because most of the time, if ever, let's say may 100 patients na may cancer, possible cancer, yung siguro yung ma-prevent ng hepatitis B vaccine o kaya nung HPV doon is mga 5 lang. But the rest, mahihirapan ho talaga tayo. So siguro, yun, one of the advocacy of Ford is also environmental protection. So, and then, of course, alam naman natin, healthy living both for the parents kasi there is higher risk also for children to if kailangan mataas healthy din ang lifestyle ng parents, no, for their children. And basically the best way or the best strategy that we see is for us to see these patients early, because if we see them early, talagang we also prevent death and we prevent disability kung makita natin sila early.
Doctora, we would like to know what are the physical or other signs of cancer in children. Kasi kung minsan, parents or children themselves, pag nagkasakit, sasabihin, ilan siguro yan, may lagnat yan. With the kinds of cancer that you have mentioned, ano po yung, para naman ma-aware yung mga family members, especially parents, or perhaps kami na rin sa media, who would know, so we would be able to inform the public, ano ba itong mga common na physical and other signs para naman ma-detect natin and perhaps we could refer them to the cancer center. And my other question is, ano po yung gagawin, ano yung process? If we are to go to here in Cagayan City, the Northern Mindanao Medical Center, ano po yung process for the diagnosis and then paid review? Or kung may fee, magkano?
I could probably answer the first question, but I will leave the second question for Dr. Go. So, unsay mga timailhan na signs of cancer sa mga bata? Now, lisod man gud ang bata kay dili man gud siya makasulti, no? Pero yung mga common na signs, kintahay kalintura, fever, common man ang fever sa mga bata, no? Pero kung dugay na ang kalintura, let's say nagduha na siya kasimana o nya na ay apil nga pagpaluspad, no? Pagdugo, pagsakit sa bukog, no? These are actually possible signs of leukemia sa mga bata. Pangalawa, ang pinaka-common sa atin dito is retinoblastoma. We usually see this, mura siyang katarata, murag matag iring, no? But we see them in children less than 5 years old. Sometimes we see them as early as 3 months old or even at birth, no? If you take pictures sa ato ang mata, di ba? Picturean nato atong mata, kung dili nimo tanggalon ang red-orange reflex, naagyo na siyang murakag aswang, imong eyes mag-red. So, if you lose the red-orange reflex, kintahay na kay makita nga puti sa mata, this one needs to be seen by the ophthalmologist para ma-screen. Now, the other things is katong mga bukol-bukol, no? Bukol sa tiyan, mga lusay nga dagko ug daghan, no? Ug mga makapa nga bukol sa tiyan, ug sa mga teenagers nato, mas common sa ilaha ang kaning mga cancer sa bukog. So usually this would manifest as usahay pain, severe pain, no? Ang usual na misdiagnosis is kadaghanan sa amuang mga a lot of our patients nga mga teenagers basketball player, no? Kay tangkad sila. We usually see the bone tumors in tall teenagers. And ang una gyud nila paminsan-minsan na halimbawa na bali ba or naunsa, no? Sometimes these are sakit kaayo, akala nila na strain lang dahil sa trauma, pero kung sobrang sakit that it wakes the child up at night, that really warrants an x-ray, no? Kailangan makita jud na samot na gyud kung dunay bukol. And kung dunay bukol or sakit na gyud, ayaw gyud ninyo ipahilot, no? Kay katong mga gipahilot nato, sure gyud ko nga maputol gyud na yang tiil, no? Because manipulation actually increases the risk of metastasis. Mauna nga katong mga gihilot-hilot, maluoy na lang gyud ta sa mga bata basketball player para ba jud most of them they will really lose the leg, especially if they come late to us. Kanang mga nagaadto sa amo, amura na pug bola ang ilang mga tiil pag-abot sa amo, and that's really very sad because we have the capacity to actually do reconstructive surgery. Do na tay gwapo kaayo nga doktor nga orthopedic oncologist na he can actually do reconstruction na pasabot dili putlon ang tiil. Kwaon lang ang tumor, i-reconstruct lang ang tiil. Pero kung dako na kaayo, sure gyud maputol ang tiil, no? So kani ang mga common, siguro na pa ko'y nakalimutan, idugang na lang ni Dr. Go. But the other is, kung naa kay makita ingon ani, unsa may buhaton nimo kung naa ka diri sa Cagayan, no? So
So anyway, dili sa Cagayan, so we have Northern Mindanao Medical Center, no? As a government hospital. So actually, we really see a lot of cancer patients in Northern Mindanao Medical Center, and as was mentioned by Dr. Dolendo, majority gyud sa cancer sa bata is blood cancer. We see a lot of leukemias, no? More than half even of the cases. Actually, retinoblastoma gamay pa kaayo, but we really hope to see, no, in the next few months, no, with this current project, siguro may increase yun ang atong rate of retinoblastoma cases, just like what happened in Davao, no? So anyway, so ang question is, unsa may himuon? Okay, so daghan depende maguna sa cancer, ma'am, unsa nga klase nga cancer. If you're talking about leukemia, naagi mga work-up ana, no, atong himuon for us to diagnose if this child really has leukemia. First, of course, is kanang unusual magud nga presentation when the mother brings the child to the hospital is ang usa is pagpangluspad, no, mangluspad kanang lagom-lagom, o na usual nila nga sign, no, nga ano dali nila sa hospital, may mga bukol-bukol, no, mga lusay, o dako ang atay, no, mga hubag, no. So initial gyud na nga test is kanang complete blood count, no, CBC. I-check ang dugo kung naabay problema, kung anemic ba gyud, no. And next is kanang bone marrow examination. Bone marrow, ambot og nakadungog na mamugon sa nang bone marrow examination, Sam siguro, no. Tanaw na to tong source sa dugo. Ang factory sa dugo is the bone marrow. So usa na siya sa mga, these are among the tests, no. Of course daghan pa kayo kung retinoblastoma, na ay mga, it's either scan or MRI, no. Available gyapon na siya sa NMMC. Okay, so question is, pila man ang gastuhon ani? Actually, kung bone marrow examination, wala may bayad ang bone marrow examination sa NMMC. We don't charge anything actually for the bone marrow. Very minimal siguro ang consultation na lang siguro ibayaran ng 150 pesos, and even if the patient, some patients really cannot afford that fee, it would just be waived, no? So, of course, for the other tests, kanang mga blood chemistries, mga CBC, they really have to pay for it, no? And, of course, for the scan, medyo nag-iba, but it is, of course, pwede yun na ikuan sa DSWD, no? Kung dili nila ma-afford. DSWD could really evaluate the paying capacity of these patients, no? And for treatment, actually, if you're talking about leukemia, sa mga bata, dako yun kung if you really buy the medications, no, more or less rough estimate would be around 250,000, no, for the 3-year treatment. So dili gyud na ma-afford sa atong pasyente nga mo atong NMMC, mao gani pamasahe, mao gani palitog ano, so dili sila ka-afford. But ang usa sa atong ginahimo karon is nay uban pasyente nga namo gi PhilHealth. no, na sila PhilHealth. Actually, PhilHealth could really help, no, na sila actually PhilHealth is now coming up with a program kanang gitawag og Z package, although it's still in the process of being really kanang smoothened out, no, apakay na sila na smooth out. And also DOH is actually also giving some medicines for leukemia, no, kaning gitawag og ALMAP, no, it's so-called the acute lymphocytic leukemia medical access program, no, wherein they give a supply of medicines to different government hospitals all over the country, no, but this is focused only on leukemias. Wala pa may program for kuani, no, for retinoblastoma for treatment. So for okay, siguro Dr. May Dolendo will expound on how much wako kibaw sa costing for retinoblastoma. I don't know how much it would cost, no. So anyway, we could actually do something in our local setting. Naman tayo mahimo, di man hopeless. Actually, we already have cure. Naman sa tayo nangaayo baya gyud diri sa ato ang NMMC, no. Naman bibisan og limited atong resources, but we also have survivors. But definitely that the ideal percentage that we would like to achieve. Pero natay mga nangabuhi man gihapon. Okay? So, na-answer ba na ko imong question, ma'am? Okay.
Actually, in the late 1990s, maupod na sa SPMC. Now, this is the common problem in public hospitals, no? Kay pagsulod, most of the time, the public hospital kulang og facilities, kulang og tambal, kulang og mao lagi na gugma lang daghan, no? All the rest kulang. So that's the reason why most of the time parents kinanglan mo out of pocket yun na sila. So that was really, you know, during that time maupod na nga daghan kayo nga matay pod sa mga bata na may cancer. But over time, no, when you go to a public hospital, kabalo naman ta nga socialized ang services sa public hospital. So that is a privilege na pwede nato na siya gamiton. So ewan ko, sa amin sa SPMC may class A hanggang D. Automatically, when patients come, class C sila pasabot, 25% lang with whatever bill ang ilahang bayaran. Pero kung walang-wala talaga, they can actually go for class D. Kanang class D, wag yun sila bayaran. But it is something, dili na siya automatic, i-interview sa social worker ang families. So in the public hospital, walay bayad ang mga doktor dera. Kung singlon mo nila, dili na siya pwede, kay ginabayaran, ginaswelduhan na sila sa gobyerno, no? May fees na consultation sa outpatient, pero kana siya, pwede na siya mapaagi sa social service. Now, ang naging effective tool namo sa Davao na hopefully, kasi importante mangyud na siya nga, even though we have support from World Child, we have support from other places, kinahanglan mangyud nga kita mismo duna jud tay sariling atuah, no? Sa amwa sa SPMC, we have the Davao Children's Cancer Fund who steps in the gap kung unsay kulang sa, it's a foundation na who accepts donations, and kung unsay kulang sa pasyente, kagaya amo ang mga pasyente, pagsulod sa pasyente, pag indigent, na dayon may charge account nga katong pasyente dili na siya mo agig lingap. Of course na ilingap, no, may lingap si mayor, pero tulo pa kaadlaw na usahay kay napay processing, no. But with the foundation, we outrightly give them murag load na 3,000 na they can charge whatever na kinahanglan nila. Unya, katong mga special tests, for example, immunophenotyping of flow cytometry nga tig 15,000 unya, kung kinahanglan gyud sa pasyente, ginaduphan pud na sa foundation. So dapat naagyud isa ka grupo nga mosuporta sa mga pasyente na whatever government cannot provide, the foundation can step in. So mao lagi na among ginabuhat sa Cancer Fund. Kung unsay dili ma-provide, and this is something na we can do here in Cagayan, because I'm sure that There are lots of kind-hearted people. Basta maayo lang ang pagpadagan sa foundation, there's lots of people who are willing to help. No, kagaya sa amin, we started walang-wala gyud, media lang among partner, laway ra gyud among before, but now we can actually support patients. So among retinoblastoma patients, every retinoblastoma patient, especially kung kinahanglan nila radiotherapy, we spend almost 250,000 sa kada pasyente. So ang RT kami gakargaan na, that's almost 100,000 kami nagabayad, no? Diagnostics, no, kung makaya sa PhilHealth, kung dili kami pod. Kay whatever the child needs, kay kung halimbawa kinsa ito naghatag sa amoa, that is the purpose. So hopefully kaning mga lessons or mga things nga nabuhat namo sa Davao, hopefully matranslate namo diri sa Cagayan para you can have more patients also. Mas daghan ta makita mga bata and a lot of children that we could help.
We go to global, in fairness to Joe Hopkins. So since Manila Bulletin is international newspaper, I would like to know, as a global, is Philippines belong to what moderate children cancers statistic? In what stage Philippines the many children cancers are discovered here, or in Asia, or in global? We want to know.
World Child Cancer works in Latin America, Asia and Africa. We come across actually very similar problems in the countries in which we work. They are slightly different in low-income countries to middle-income countries. The Philippines being a middle-income country, you share some of the problems that Colombia is having, which is another country where we work. One of the things that I've noticed here during the visit is that the stage in development that Doc May is at in Mindanao in terms of developing a satellite network is actually more progressed than some of our other projects. Some of our projects in Africa are focusing very much on just one hospital and trying to create a centre of excellence in that one hospital, and they're not ready at this stage to develop a satellite network. So they are actually at an earlier stage in development. So where you are now in the Philippines is actually very positive, because May has done a lot of enormously good work in developing the SPMC in Davao into a centre of excellence, which can become the hub of a satellite network across Mindanao. So that is incredibly positive, and I think you're at a very exciting stage in development, because from where you are now with a 5-centre satellite network, you can actually expand it further across Mindanao, trying to reach even more children. But as I said, the problems that you face in the Philippines are similar to other countries. Abandonment of treatment is a major problem, late diagnosis, and also non-diagnosis. We find that when we go into most countries, Ghana and Bangladesh are two good examples. They're both countries where we work. We find that probably only about 10 or a maximum 20% of all child cancer cases, or all suspected child cancer cases, are diagnosed. So there is a huge amount of work that needs to take place in awareness raising, to raise awareness of the problem of child cancer, what the symptoms are, and also that it is curable. Child cancer, as May has said, is very different to adult cancer, and it is curable. In developed countries, you get about 80% survival rates on average, and it's possible to get rates in a country like the Philippines up to a fairly high level, 60-70%. Thanks. 60 to 70% for the easily treatable cancers like leukemias. In fact, retinoblastoma is probably even higher, isn't it? Yeah, and also Wilms tumour is probably high. That's another very easily treatable one. And it's fortunate that the easily treatable cancers are often the ones that have possibly a slightly higher incidence as well.
Be able to help the patients is the patients will go to LMC, then it will be in a socialized form. So are you going to shoulder for the medication expenses? And if so, how can they avail it?
As I mentioned earlier, we are more into the logistics portion of the early childhood cancer campaign. Many times during this press conference, we are always asked how much is the amount. Actually, hindi ho namin ma-quantify ni Doc May kasi more often than not, what we provide is the venue, the manpower, as Doc May telling us, mahirap i-clone si Doc May, no? So what we do is we help in the registration, may mga manpower requirements si Doc May in each of these satellite clinics niya. And one important thing that I believe which I think we can help in the early child cancer campaign is actually putting up the posters of awareness in our dealerships, and whenever there is a customer or anybody who walks in and asks us about the campaign, what we can do is we refer them to the proper channel kasi most often naman hindi naman nila alam saan sila pupunta or hihingi ng tulong, di ba po? So ang ginagawa po namin is Doc May has promised us that she will orient all our frontliners para kung may magtanong, anybody who wants more information about how they can get help, kahit na example yung kanilang kapitbahay, mabigyan po namin, we can direct them to the proper agency po. Yun po yun sa amin. Thank you.
Since ginawa sa diri, do you have plans to help build mga centers, just like in Davao, multiplicate na
No, we are actually very fortunate na kahit papaano, we have been chosen as the corporate social responsibility of Ford. Alam naman natin, they're a business. Hindi naman ho nila responsibility itong healthcare. Trabaho ko po yun. So they're just helping us out. So isipin nyo, if I come here and wala itong Ford, gagastos pa ho tayo sa venue, gagastos pa sila ho yung nag-sponsor ng lunch. So gagastos pa ho tayo dyan. Pati yung mga tao na tumutulong sa amin, I must have staff here. So, malaking bagay din po yun, na instead na gagastos kami doon na lang po sa ibang bagay like training o mga gamot ba, maitulong natin. So, ang laking bagay din po yung naitutulong ng Ford sa atin, and especially po yung awareness campaign kasi hindi naman ho lahat pwedeng makapasok dito. Yung Jensen nga nila na dealership, hindi pa nalolaunch, na gamit na ho namin, nahiram na ho namin. So, hindi ho natin ma-quantify, malaking bagay din po talaga ang binigay ng Ford sa atin. And si Mr. T10 po, yung kanyang golf tournament, he promised na some of the proceeds bibigay daw niya sa amin. So, let's give him a big hand. Hindi lang this year ha, sunod pa. And susunod pa. So yun. So we are very thankful that Ford has chosen us as their corporate social responsibility. The center. Yung center ho, trabaho talaga yun. Now, I think there's a lot of movement sa NMMC. Kung na-notice ninyo, halos hindi nyo makilala kay left, right, and center, nagre-renovate sila. So, yung center po, trabaho talaga yan ng Department of Health. And as you can see sa NMMC, marami pong renovations going on na I think Fido can tell us more about it.
Actually, sa NMMC, if you see, it's being renovated, no? But actually, we have a chemo unit in that area, but there really is not any more space for a transient home, just like the House of Hope, no? So kulang na yun, wala na, pwede dugangan pa, babaw na atong kuan. So that's one of the things. It's actually, I don't know, for now I don't think it's one of the major plans yet of the hospital. But we will try to talk it out with the chief of hospital. Yes, if they could Yeah, probably May is very good at looking for donors. But actually, that's one of our long-term plans for Northern Mindanao, that hopefully in the future we'll have a similar transient lodging house for those who are from the neighboring areas, no, have to stay here for a few days and they have no... For now, actually, ang ginahimo namo kana tagalayo, kay dili man pwede admit na may ibang patients. There are some patients who don't really need to be admitted, no? They just have to come in for the injection. But some injections have to be given every day for around 5 days, no? So wala sila may puyan dire. So sometimes we just allow them to stay in the ward, but that's not really very ideal, no? But it would really expose them to more infection, which is really bad, no? But wala man tayo mahimo, no? So unless ugnay mo sponsor sa inyong lugar sa balay, pwede na mo papuyan sa inyo. Pwede gihapon. Okay.
I would like to elaborate more sa House of Hope kasi this is truly a project. Kami ni Belle, kaya din kami nagka nito is because we are both members of the Rotary Club of Waling-Waling Davao, and House of Hope is actually a project of Rotary Club of Waling-Waling Davao. Now nganong gi-prioritize mangyod ang kapuy-an, no? Kay do na pa may laing kinahanglan, tambal, doktor, space and all that. Kasi if you see the treatment for child cancer, dili na siya 1 week lang. It takes months, even years. So kinahanglan jud mo pabalik-balik ang pasyente sa hospital. So mao na nga importante kaayo nga do na siya kapuy-an nga duol sa hospital para maka-continue siya ng treatment. Kasi maski even if you have medicines, maski do na kay tambal, kung ang pasyente nimo di na mo balik, pagbalik ana relapse na, sayang pud tong imuhang libre nga tambal gihatag from the very start. So mo na nga importante ang transient home, and hopefully we can there will be opportunities. Anyway, we've been andito na rin kami. We'll see what is possible dito sa and we have a wealth of experience that we can share with Cagayan de Oro so that we can help more children.
Can you explain the cause of brain cancer according to her?
Butang niya ang iyahang, because we have medical students who do this. Katong gibutang niya yung tiil sa tubig is because she wanted to be awake. Para maka-study siya, but that does not cause brain tumors. No? So, ang brain tumors, just like anything, multifactorial po na siya, pwedeng genetic, pwedeng exposures. There are so many things. Ingon nila, waves, no? Electrical waves o usahay cellphone or unsa, pero dili magud ni siya established, mga kuno-kuno lang na siya, dili na siya established na causes of brain cancer. And sa tinuod lang lisod gyud ang brain cancer. In fact, wala ko'y programa sa brain cancer kay lisod gyud siya, daghan gyud resources at our point in time. Kay una kinahanglan gyud nimo gwapo nga neurosurgeon. Lisod man good ang brain cancer kay sa utak man good siya ni tubo, no? So huna-hunaon nimo, ang importante man good sa cancer kailangan tanggalon gyud nimo nya. So kung tanggalon nimo, utak man good mo gitanggal. So we know that the brain is the seat of all our functions. So mao na nga lisod gyud siya. So dili lang gwapo nga surgeon imong kinahanglan, ICU, radiotherapy, usahay siguro for certain types of brain cancer like medulloblastoma, chemotherapy. So daghan gyud ang needs for brain cancer. So that's in the future, pero di maglisod gyud make develop og programa sa neuro-onc at this point in time. Ang strategy man good, kung unsa tong pinakadaghan ug unsa toy pinakadali, mao sa namong ginauna, no? Kay para kay gamay man gud atong resources. So mao na nga we want to allocate our resources to that which can bring the most good, no? Although wala man taga-ingon nga pasagdan na nato na sila, pero at this point in time medyo in neuro-oncology medyo nasa early stages pa.
When we talk about kidney cancer, murag high-tech kaya siya na sakit. Most likely, murag kasagaran na may goal itong mga adunahan. No, murag wakay kong nadumog, nas pobre. So ako papamalaan naman, no, itong sakit ng cancer sa inyong record, based on the record of asa ba yung taas na rate sa mga dato ba? Ang naigo, ang mga patient tawag, dito mas dato o dito mas pobre. So, lugar, kung galing tuwas pobre, kung galing tuwas dato, kung sa'y kasagaran ng mga ini kasagaran ng mga poets dito nga maigo sa cancer, pinaali mas pagkaon. So, kanalang tingali, ma'am.
Walay pili ang cancer. Cancer that is the great leveler. No, it does not choose. Dato ba ka o pobre ba ka? Kung iguon ka sa cancer, imong anak iguon, wala na siya pili. Siguro mas daghanta na nahibawan sa mga adunahan because they have the capacity to be diagnosed and to be treated. Wala tayo nadunggan kaayo sa mga pobre kay halos sila makaadto sa hospital, no? But for now, if you see, we have lots of survivors already. So, walay pili ang cancer. Dato ka, adunahan, pareho lang. Ang kanang sa pagkaon, actually, if you notice, that is also lifestyle. So, it's more of sa adults food. Sa children, ang junk food, dili man yun na mo ingon nga cause siya ng cancer, di siya makakos. Na as a single, junk food, sweets, mo ingon sila sweets, junk foods, ayaw mong kaon anak kay makakancer. No, those are just one of the things. Kaya una-unaon ni mo, daghan man bata nagakaon og junk foods, daghan man mga bata nagakaon og kaning processed na anong wala sila nagkanser tanan, no? So there are other factors apart from this that causes child cancer.
Good morning, Doc. Sa tanan, good morning. First, I have two questions. First, I will para kang doktora is possible naman sa karang naman is high-tech na kayo gamit ng computers and other gadgets. Maka-cause ba kaya siya cancer?
Can contribute, but I think we need more studies on that. Kasi lisod good siya. Trisha, do you have studies to prove that? Kasi Doktora Alcasabas, ni siya, epidemiologist ni siya. Magaling yan siya sa mga ganyan. So, baka Trisha, pwede mo ako tulungan kay ang tanong ni Sir is, kani daw ang mga computers, kaning mga internet, makakontribute ba daw na sa cancer?
Epidemiologic studies kasi medyo mahirap gawin. First of all, let's say when we talk about cancers in children, in Filipino children, based on our population-based cancer registry, just based lang in Rizal and Metro Manila, we're talking about 100 per million children aged 0 to 15. So if you ask me, anong percentage of childhood cancer? So 100 divided by 1 million is 0.0001%. will get cancer. So when you try to understand them, then how does internet or computer increase the incidence, for example, of cancer? Then you would have to get a pool of children with cancer and children without cancer, and then you try to ask them, how much time did you spend on the internet? How much time did you use the cell phone? And also, there have been studies like this, looking into studies like this, but they cannot conclude. For example, one actually, I was looking on the question that yun bang exposure to infections in children, as children, will that prevent leukemia later on? Because I'm thinking is that American children, as compared to Filipino children, based on statistics, get more leukemias, but Filipino children get more retinoblastoma. Is it the reason why we get less leukemias? Because bata pa lang tayo, ang dami na natin sipon at ubo. So pinag-aralan po nila epidemiology na naman by looking into schooling and child care and the incidence of leukemia in school children and in child care. And again, confusing din yung data. So I'd like to say na we don't have that direct evidence, but maybe later on.
Morning, Joey Silda, Mindanao Daily. Di kayo kumuha yung istorya sa igagaw ng cancer para sa mga dato. Kay ako pobre kayo, wala ko'y Everest. Nga kung sakinan is for Everest. Pero namatyan ko, anak. I lost a son to colon cancer about 7 years ago. 30 years old. Ulitaw, no? So di ko mo to para sa tingin na mga kiniskita. Anyway, that's not my main concern. My main concern is your entity being a charity entity, no? Ang pangtangan ako, asa rapid ang charity dinhi? Asa rapid dinhi ang for a fee?
Yes, ma'am.
Sa SPMC, I can only answer sa SPMC, no? Kay dili man tanan. Ang Davao Children's Cancer Fund is based in Davao, and we raise funds doon mismo sa Davao. So ang beneficiaries namin are the children with cancer sa SPMC. So pag naka sa government hospital, pag doon ka sa government, I was already telling you about that earlier. Pag naka sa government hospital, naagad na yung mechanisms nga ang gobyerno mismo doon na siya tubag para sa mga indigent patients. Katong dili matubag sa gobyerno, the foundation steps in. So ang gawas ni ana, wa gyud bayaran ang pasyente nga dunay cancer sa SPMC. No? That's something that we would like, dili magud ta gusto nga problemahon pa na sa pamilya ang cost, kay nakita man nato nga basta maski anak pa siya sa laborer or anak pa siya sa fisher folk or tigkuha og buko sa coconut tree, basta masuportaran lang siya, they can actually survive cancer. Maunang amo ang gipakita diri, no? So it's something that we would like, it's a model that we would like to develop in other places. Unta diri pud sa Cagayan de Oro, do natay mabuhat na kay dili man ang problema ho namin ngayon kasi dumadami na ho yung pasyente namin. Syempre yung needs ng foundation also increases kay daghan na mi ginasuporta, no? But that's a happy problem. Okay ra jud na kay kwarta lang atong pangitaon, no? Pero kaning mga pasyente, it's a chance for them to be saved, no? Kay if you save a child with cancer 5 years old, buhi siya 50, kalain mo yung 45 nga gibalik nimo sa iya, ha? So sa SPMC, we have developed that mechanism nga ang problema lang gyud sa pamilya is to go to the hospital and be treated. So it's something that we would like, no? Dili na siya mahitabo today diri sa Cagayan de Oro because it took us 8 to 9 years to develop that in Davao. But it's a model that we are showing could be successful and could produce good results. And mauna ang ako ang gusto nga i-share diri kay Dr. Go sa Cagayan de Oro. So hopefully, kay wala man sila nag-agi sa amo ang kaguol, no? Na we have had a lot of lessons. Kung ma-share na mo to ang lessons kay Dr. Go, dili na siya moagi sa amo ang kalisod from 2004, no? Mo share na lang mi sa iyaha. So hopefully kanang 8 years sa Davao, 4 years lang diri sa Cagayan de Oro. It will not happen overnight, but with everyone's help, for media, kaming doktor, no? We can do it. Kaya siyang gawin. If there is anything that we are able to show you this today, it's that it is doable. Cancer is curable even among the indigent.
Okay, as I have said earlier, no, sa atong diri sa atong NMMC, we're actually doing something with these patients, no, for these patients, no. We are offering actually free man ang services gyud diha, no, because it is a charity institution. So wala mo gibayad consultation fee, everything wala magyud except dili lang gyud totally free gyud tanan, no. Nagi gamay sila mabayaran for the laboratories, no. So nagi mo shout out gyud sila gamay. Kung sa tambal pod, majority gyud sa ila di gyud sila maka-afford gyud sa tambal. Mao na nga sa akong gisulti ganiha, naagyapon tayo makuhaan, no, kani mga ga-support, no, katong giingon ako nga acute lymphocytic leukemia medical assistance program, usa na siya PhilHealth and even PCSO, No, actually ang PCSO dako gihapon og tabang. Ang PCSO although medyo delayed lang gamay pero nagitay makuha. So sa atong setup sa pagkakaron dili gyud ta makaingon nga wala tay mahimo sa mga pasyente nga moadto sa nga budangop no sa NMMC na magyutay mahimo no initial workup and counseling nagyutay mahimo and we are doing really the best that we could no kung sa imong mahatag didto amo yung ihatag no pero usahay nagi limitation mo nang usahay nagi ka nagitaw ko abandonment bitaw pero nagi uban ginikanan nga maayod mangita og resources bitaw gihapon no nga mobalik it sila and kani silang mga ginikanan nga maningkamot the more gani nga amo gyud gipangitaan gyud og tabang. So and hopefully with this kaning partnership hopefully mas natay matabang sa ila later on no na imaduga nga support ba. Okay.
Wala yung question sa PCSO, matabang gina, Doc, no?
Although limited.
Yes, but I wonder if this program could be affected by the abolition of PIA.
Probably. I don't know. Hopefully, dili. Ano, kay sayang ba yapod? They actually get around 10,000 a year. For kung na sila ceiling at 10,000 every year from PCSO.
Thank you, Doc. Thank you po.
Ano lang, follow up lang to na nahisgutan naman lang yun na. Oo. Kasi even our House of Hope was given by Senator Cayetano from PDAF. So affected jud me. Pero ang akong hope ra jud with the changes, no, kami naman good, we choose our battles. No, kaning battle for cancer, lisod naman gani ni ang sa gobyerno problema, it's a bigger problem na dili kayo takakwan. Ang hope lang nako nga kung i-abolish nila ang PDAF, they will give it to the line agencies. And if they give it to the line agencies, they will give it to Department of Health. And if Department of Health gets the money, I hope na ilahan na siya ibuhos sa mga indigent patients nato. Karon man god, ang sakit ra gud niya ng PDAF kay murag kita ganing gabeg nga moadto ta didto sa mga congressmans whatever fund nga kung sa bagay pera natin yan. No, moadto pa ka didto mo pila-pila pa ka. Whereas kung diretso siya sa Department of Health, di ang chief of hospital nga nung dagan kag kwarta nga nung di ka kapatindog og cancer center. So I mean, I'm just hoping and that government will be more transparent with how they spend our money.
I'm from Business Week. For Sir Willie, I have a question. Sa tagal po na car dealer po, may nare-record ba kayo ng mga cancer patient na dahil sa car pollution?
Wala pa naman nagrereklamo sa amin na nagka-cancer sila dahil sa kotse, no? Kaya hindi ko masagot 'yan, ano.
Alam naman natin that environmental pollution, talagang second hit yan siya. No? Second hit yan siya for, ano yung second hit? Ang first hit man god is genetic susceptibility. No? Katong sa pamilya nato. Ang second hit is from environment. Whether it is from pollution, whether it is from pesticides, whether it is from mining, no? Ano talaga, yun yung second hit.
Sir, I have read your background. And I just would like to know what is the participation of Millennium Cars Mindanao Incorporated to Davao Children's Cancer Fund and soon to be CDO Children's Cancer Fund. Thank you.
Actually, this was answered a while ago by both Maribel and Doctora. No? We're here to support the Davao Children Cancer Fund in terms of like activities like today. No, we sponsored the venue. From time to time we'll sponsor the food as well, no? But more important is the information dissemination. All our dealerships in Mindanao will have the flyers, the posters, the brochures for families here in Mindanao, especially the mom and the dads, no, the parents, that if they see something in their children that is quite different or abnormal already, that they could always ask where the clinic are, who to talk to. We can guide them, we can even transport them, and of course for logistic purposes also, because her team would go around Mindanao also and teach the parents how to detect the early detection of cancer, and we're here to support them in all the logistics needs, no? And not only in terms of transportation, but in terms of manpower, in terms of everything else. And aside from that, hindi lang namin sinasabi, but eventually, of course, the monetary support will also be there, no? As I've said, as we've said in Davao before, that we're going to support them through our charity golf tournament. Also, we're aside from Bantay Kalikasan, Davao Children's Cancer Fund will be our beneficiary for this year, and for hanggang may golf tournament, it will always be a beneficiary. Thank you.
How do you make a child understand he has cancer? And has our Filipino doctors in general succeeded in curing, not just treating cancer in children?
Alam naman natin na yung mga bata meaning 18 below, no? So we have age-appropriate ways of teaching the children, no? And we always want to tell them, kay na mga good parents usahay nga dili gusto i-reveal sa bata nga duna siya'y cancer. And that's really very sad because the child will go to a cancer center, no? So moingon siya nganong mo adto man kog cancer center, unsa day akong sakit. So it's very important for children to trust us, and importante talaga na alam nila kung anong sakit nila para naiintindihan nila, and we know that information is very important. What we don't know really will scare us. Ato aga ni tigulang mahadlok man ta samot na gyud ang bata. But you will be very surprised. We have lots of children na mas magaling pa sila paminsan-minsan kaysa parents nila to deal with the diagnosis of cancer. No? Alam nila, if you tell them ganito ang cancer nila, ito ang dapat gawin, they're actually have better coping mechanisms than parents. So age appropriate yun. Syempre, yung below 5, hindi masyado nakakaintindi, pero the longer that they go to the cancer center, and sa amin, especially sa SPMC, nakakatuwa. Kasi paminsan-minsan papasok ka sa ward, tatanungin mo yung bata, nganong naamang kadiri karon? Ay, mag-IV vink ko, dok. So, kabalo na siya unsa iyang tambal, no? Or dok mo, magpa-LP me, magpa-IT me, no? So, we are able, and we have lots of support to do that, no? We have the Child Life Program, no? Na may Child Life Coordinator na by play or by conversing to the child, they are able to teach them kung ano yung diagnosis. We have the quality of life service na nagahelp pod og counsels not only sa mga bata ug sa mga tigulang. Well, you know, unfortunately, dako magud kayong Pilipinas. Pila ra gud pod mi nga oncologists. There are only 33 of us for a whole country of 89 million people. And you know, 40% of that is children. So dako gyud ang needs. Unfortunately, across the country, if you just take the whole country, dili single institution ha, kay let's say sa SPMC we can say na naami sa 60 to 70%. Pero kung you put the whole country in totality, ang survival nato sa cancer is only less than 20%. And this is because dili pare-pareho ang resources, dili pare-pareho ang walay center in other places, and even if there are centers, dili pareho ang services nga ginahatag. So what we are trying to do is actually to revolutionize the care of child cancer in our country by serving as a model na kung pwede palang gawin na ganito. We can actually save children if we do this. So hopefully in other places, if they are wise na dili na sila moagi sa among gikalisdan, sundon na lang nila mi, they would benefit from our experience. No, it's just, you know, they just have to have an open mind. And how to be vigilant. Syempre ito, this is a way of telling people na the early signs of cancer, if they get it, where do they go, unsa ang mga pamaagi, no? So this is one of our strategies to make the public vigilant. Actually, dili na ako na siya trabaho na ninyo as media people. This is your social responsibility to help us in getting to these children. Kay kabalo na mo nga treatable man di ay na sila, So send them to us. Oh, so di na ako ni trabaho ninyo na.
My question is, kanang magbunod ang breast or part sa yung tiil, laluot, kusog, kinabanggaan. Ingon nila makanser. Kung sa movement sa ilalo, manang makanser man ang breast na nasubagan o kusog. Commonly na siya na may bago.
Earlier, katuganing ingon nako nga naay mga teenagers usahay nga nabunog sila no kanang ilang tiil na bunog unya mo ingon sila tungod na bunog siya mao na nga nagka-cancer. Actually that is wrong. Sa nagkaroon siya the bone na fracture ang bone, nabali ang bone kay nagweak na siya kay duna nay nagatubo sa sulod daan. No, so it's not the outside trauma but the cancer was already there. In fact, katulang ang activity ang paminsan-minsan that led to the diagnosis. Now, wala ko kabalo ng nabunog sa breast. I don't know about that because I don't see patients like that. Siguro if ever, katong sa mga rib cage, amo ang mga pasyente na may Ewing's cancer, that's a type of cancer sa rib cage. Similar na siya sa katong mga na trauma sa tiil, no? There was already cancer in the bone. Mao na nga nagkaroon ng fracture kay weak na ang bone because of the growing cancer inside it. So, dili ang trauma. The trauma was the only thing that led to the detection of the cancer.
When a person gets sick, get admitted to the hospital, then laboratories are conducted, laboratory tests are conducted, then doctors come in and then diagnose the patient. And how many stages would it take before you're going to reveal that the patient has cancer? So, after revealing that the diagnosis that he has cancer, would it be necessary for you to refer it to other physicians or to other doctors that can conclude or that will give the diagnostic which is conclusive that it is cancer? Because there are other incidents or cases that a person was diagnosed with cancer and then he started taking medicines and then he has this chemotherapy and then it so happened that at the end of the day he has no cancer. So he is just called a survivor. But from the start he had no cancer. So would it be necessary for a patient to have a second opinion about the first opinion?
Yung opinion or second opinion katungod jud na nato no as patients no kung dili ta komportable sa diagnosis, it is always our right to seek out a second opinion. But this is something that I need to tell you. Cancer is not an easy diagnosis. Mao na nga obsessive compulsive jud ko sa diagnosis no na kung dili namo ma-diagnose, actually ginapadala namo either sa Manila kay namagod, for example here in Cagayan de Oro or in Davao, dili magud ta kompleto sa tanang investigasyon. Na magud usahay cancer nga pare-pareho na ihang itsura, pero if you do special test for them, you would be able to identify kung unsa gyud na siya nga klase nga cancer. Now the beautiful thing with our international partnerships is kung nami mga pasyente ingon ana, pwede namo mapadala sa US. Pwede they will do the diagnostics to us for free. So mao na ang kagwapuhan. And the beauty with pediatric oncology sa mga bata nga dunay cancer is dili ko alone, no? In fact, it's very humbling kay kinahanglan nako ang surgeon, kinahanglan nako yung radiation therapist, no? You need, it's a multidisciplinary. Kung nag-ingon ang oncologist nga siya ra jud ang kinahanglan sa pasyente, that is not correct. Kasi it's a it is a multidisciplinary type of disease na kinahanglan og multiple disciplines, no? So we would always go for the correct diagnosis because it's not easy for you to be told na you have cancer. So before I tell you, sure jud ko, maski madugayan pa ta, basta sure ko nga cancer jud na kay lisod, dili di ay cancer, no? Because the treatment that we give is not antibiotics. It's actually chemotherapy, which is toxic. So mauna nga the good pediatric oncologist will always have to make sure nga cancer jud ang diagnosis before you initiate treatment. And sometimes it takes some time to do that.
Thank you everyone for attending Dr. May's very passionate campaign for early childhood cancer. No, we just want to make sure lang that the information given by Dr. May is really relevant to all of us, especially sa region natin in Mindanao. We also have, although Dr. May earlier mentioned that we already opened our Gensan office 2 weeks ago. We are hoping that within the year we will also be in Zamboanga, just like what Dr. May said, so that we will be able to help her also in her campaign there. Thank you.
Yeah, thank you for coming today. The only request we'd have is probably for media to continue the campaign of Dr. May through information dissemination. That's the most important thing, I guess, so that the parents of children with cancer would be able, because they're the first person to notice that, they're the first person to be able to help the children. The children themselves will not know all these. No, it's the parents who will detect the cancer. So I hope the media can help out. We're here just to support Dr. May in whatever way we can, and we believe that she's doing a very good charity work to all the people of Mindanao. That's why we're here to support her. So the golf tournament is in Luzon, but the proceeds we will bring here, or maybe in the future. Thank you.
Ako magpasalamat na lang gyud ko sa tanan for your time. Remember nga dili man gyud ta kinahanglan dato before ta makatabang. So it's actually time, talent, and treasure. And the media has shown that you have given your time and hopefully share your talents para sa amoang advocacy. I would like to thank. Alam nyo, ang dami ko in the past several press conferences with Mr. Titen, ang daghan pud ko na nakatunan sa iyaha. So I would like to thank him and Bell and Ford. We are very inspired kay kami trabaho man gyud namo ni ang Ford lahi man gyud po nila ang trabaho, no? So we are very inspired by all the things that they do. I would like to pasalamat ko sa Wind Beneath Our Wings, si Irvin og si Caris, no? Mauni silang mga elves namo nga makes things possible. And of course Joe Fido, he has a big job ahead of him. Tabangin ninyo siya kay gihulam ra ko diri niya isauli man pud ko niya sa Davao, no? So siya gyud mahabilin diri. So thank you so much sa tanan, no? Sa Ford Cagayan de Oro, kay Hector, thank you so much.
World Child Cancer is really delighted to be working in the Philippines and to be working with Doc May and her team. There's so much progress that's been made, and the satellite network here is a fantastic example of what can be achieved by extending from a hub hospital out to hospitals across the region. And we're learning a lot from what Doc May has done here, and we're hoping that we're going to be able to replicate the model that you've created in Mindanao in our projects in Ghana and Bangladesh. So this is fantastic work. It's not only helping children in the Philippines, but it's actually also going to be creating that model to help children elsewhere in the world. Thank you.
Okay, so once again, I'd like to thank Dr. May Dolendo for adopting us finally, and I'm very positive that things will really work out well for Northern Mindanao with the support of everyone, of the media, World Child Cancer, Ford, and DCCFI. I'm sure everyone and even we have already started actually reaching out to some of our NGOs like the Philippine Pediatric Society, which we are all members of. we've already arranged it with the president of our local chapter that they will assist us in disseminating this information to Northern Mindanao, which is a very big catchment area. So we really need the help of everyone. Okay, thank you.
This is a bead of courage given to a child with cancer for every procedure they go through. This one is for a clinic visit. This one for a spinal injection, intensive care, chemotherapy, bone marrow transplant. These are Emma's beads, all 1,900 of them. With your help, the Child Cancer Foundation can continue to be there for brave kids like Emma. Please give generously. You can even text BEAD to 206 to donate right now.